Welcome back to HealthWise. My special guest today is Dr. Eric Chapman, and we were talking about the swine flu before we left for break. Doc, we were talking about the testing, and I was telling you about my experience, and I know it was very uncomfortable. For those of you that don't know how they test for influenza, the new testing method, they take a swab and they put into each nostril, and they basically have to kind of twirl it a little bit, but it doesn't hurt. It's just a very uncomfortable pressure feeling that they do. Doc, I don't know what they do in Mexico or any of these other countries, but that's something to think about. You know, that I read the CDC said before you come back, you do have to get tested. So what's your take on that?
Yeah, I think they've just been more vigilant about it. And again, it's not a needle stick, it's nothing like that. It doesn't involve a blood draw, but just the fact that something's going pretty far up into your nostrils is uncomfortable. But it's the easy way to test. You get results within a half hour to an hour easily to know whether you have influenza A and also influenza B. Now, it doesn't specifically tell you whether you have swine flu or not, or the H1N1 type. After that, then they'd have to do further typing of it to classify the virus. So it would just tell you yes or no, you have influenza A or B. Okay. Would be the answer you get from that.
Okay, and we were talking about, I think it's also good, over here we take for granted, because if we get sick over here, we go to the hospital, you don't have to worry about insurance, or, you do have to worry about insurance, but even if you don't have insurance, you're assured that you can still go to a charity hospital or something. And we were talking about that, and I think that people need to understand that they need to have insurance. If they, I guess they call it traveler's insurance or whatever, medical insurance.
Yeah, one thing that the CDC recommended was to check to see if your policy does cover travel abroad, your medical insurance policy. The other thing they talked about was getting potentially paying for insurance to evacuate you from a foreign country if you were to become severely ill. One of the points they made is that the government agencies, the embassies, the military, don't have the legal authority to transfer you from a foreign country for a medical emergency, nor do they have the authorization to treat you, whether it be with vaccines, medications that would be dispensed, or any of these other measures. So, if you were to become severely ill in a foreign country, you could find yourself in a bad predicament. So that's one of the things that they said, look at potentially purchasing insurance for medical evacuation if you were to become ill, and also just checking into your own private insurance whether you do have travel coverage when you are abroad.
That's good to know. So everyone that's thinking about traveling to any foreign country, or specifically Mexico or anywhere, that's something to think about, that you need to make sure that if you get sick, you can get back home. We were talking before the show, and I'm even thinking, the prices are very low going to Mexico right now, going to Cancun, and a lot of people are taking advantage of it, and myself included. And I'm going to make sure I have the insurance so I can get back home if something happens or if I get sick. Yeah. Doc, we were talking about pregnancies also. I mean, I know a lot of people are worried about if they're pregnant and if they get the swine flu or even just regular flu. Does that affect the fetus? Well,
with the swine flu, this subtype, H1N1, they've not shown that it can directly affect the fetus, but it's still really unknown. For the mother, again, you'd want to certainly take those precautions. Women who are pregnant are a little bit higher risk of having complications, pneumonia especially, and then some other complications, potentially early labor if they get the flu during pregnancy. So the same thing would hold true, they think, with this specific virus, with this specific type of influenza. So, you would need to see your gynecologist, your obstetrician, and make sure you'll make them aware of the symptoms, monitor yourself closely as far as symptoms, and they would make a decision as to whether to treat you or not for the virus specifically. And a lot of it is supportive care also, making sure you're adequately hydrated, treating the fever to keep that controlled so you don't have complications from the fever, that the baby doesn't as well.
All right. Well, and then I guess too, a lot of times with pregnancy, there's precautions anyway that you're going to take. You know, the mother is more susceptible, and you don't want the mother to catch anything. You know,
Exactly.
flu or anything. If the mother, should catch the flu or someone around you suspect, would the mother be, would she wear a respirator, or I guess even just a mask?
Yeah, there's different levels of mask, and surgical type mask gives you, that you can purchase usually in a pharmacy, would give you pretty good protection. As far as distance, what's been recommended is keeping a distance of greater than 6 feet from someone. We think that should give you a good distance as far as keeping you safe from transmission through just cough and sneezing. And then beyond that, the direct contact you'd want to avoid as much as possible if they're around someone who they think has flu or some other viral illness. Again, there are certain illnesses that definitely give the fetus higher risk when the mother develops them. With influenza, again, especially this subtype, that's not clear, but you just want to stay as healthy as possible, obviously.
Sure. Well, like I said, that's something that, is good to know. And washing hands, like we said, for sure, because a lot of people don't wash their hands. They don't do, and that's an easy way to keep from getting the flu or any kind of infectious disease.
Yeah, that's something that's been really just neglected. And even when we talk about just medical care in general, that's been shown and studied over and over again, just for reducing the risk of transmission of infections, cross-contamination from one patient to another, and certainly just in the general population, washing hands is just a first very easy step that gives you a lot of protection.
That's good to know, Doc. And we'll be back after this brief message from our sponsors.